While most university presidents are shaking hands and crunching numbers, Dr. Jay Perman is practicing pediatrics and making UMB a national center for battling childhood obesity. Welcome so much, Dr. Perman, and thank you for joining us.
Jennifer, it's great to be here. I'm glad to talk about this with you.
Well, it's such a huge problem, and we've heard you refer many times to childhood obesity before as the #1 health problem. Do you really believe we're making any headway?
Well, I think we are. I think the good news is that nationally we're beginning to see a leveling off in what was such an accelerating rate of children and adults becoming overweight. Now, we don't understand why the leveling off, and we shouldn't get complacent because it's just a leveling off. We have too many children who are too heavy.
Well, as a pediatrician, when did you start to notice that juvenile obesity or overweight issues was such a growing problem?
Well, my subspecialty is pediatric gastroenterology. I take care of children with digestive diseases and liver problems. And probably several decades ago, we began to appreciate a group of children who had a peculiar form of liver disease. They accumulated fat in their liver. And it became very clear that this accumulation of fat in the liver was due to the children being heavy. And this is a major issue because left alone, those livers will be damaged and scarred. That's when I began to realize that the liver and many other organs, many other systems of the body are tremendously impacted by children carrying too much weight. We have to do something about that.
Well, as adults, we often control our own eating habits, but for children, it's so difficult. How do you get parents on board with choosing a healthier lifestyle?
Well, you've said it very well. We shouldn't talk about children being fat, parents being fat. It's really all about choosing a healthier lifestyle, not being blameful of children who are getting heavy, understanding that some of this is genetics, but encouraging behavioral patterns, particularly getting out, being active, not sitting sedentary, watching the games, etc., playing the games. And of course, children model what they see their adults doing. So we as adults, we have to eat well, we have to eat properly, and we have to move around.
We want them to do as we do, not as we say.
Yes, they figured it out.
Well, I know you've been so instrumental in making the University of Maryland the #1 center for battling childhood obesity. So tell me about what you're doing there, bringing scientists and researchers in to tackle this problem.
Well, at the University of Maryland, Baltimore, we're in perfect position, I think, to deal with a societal problem as severe as childhood obesity. And the reason I say that is because of the nature of childhood obesity. Childhood obesity is not like stamping out an infectious disease with a vaccine. It doesn't have a single cause. Childhood obesity is based to some extent on genetics factors, as we discussed. It's based to some extent on our behaviors, and it's also based to some extent on the environment in which we live. So when you think of the University of Maryland, Baltimore downtown, we focus on all of that. We're a human services university. We have investigators who look at the molecular basis of obesity, and we have behaviorists who look at what we can do in schools to change behavior and make a better environment. And then with regard to environment, we have people who do social work, people who help with policies, people who help with laws in our law school, and all of this comes together. If we can pull all of this together, and we're so positioned to do that, we pull all of this together and focus on obesity.
And you're looking at this not just in Baltimore City or Baltimore County, but really all across Maryland. And the numbers are staggering. 20% of preschool-age children from low-income families are obese. So why are these children so overweight and undernourished?
Well, we need to be very sensitive to children who live in environments that do not encourage the kind of activity that we would want for our children, where foods are not available and affordable.
You're talking food deserts and unsafe neighborhoods. I'm talking about
food deserts, and I'm talking about unsafe neighborhoods. And we're not going to fix the challenge of childhood obesity in the populations that are most severely affected unless we also accept our responsibilities for these social conditions.
Well, and it's not just a social issue. We're talking about a serious health risk for children who are obese. What are some of these risks that they're facing?
Well, that's so much the pity of obesity. I mentioned the issues with the liver. Obviously, obesity is not good for the cardiovascular system. It's not good for the joints. It's not good for our emotions and the way we feel about ourselves. It touches everything. And that's why we've got to counteract it so these children have a better chance as adults.
Well, we know that some of your own pediatricians there at the hospital are finding some very serious real health issues. We're talking diabetes, heart disease.
Exactly. The tremendous upswing in diabetes is directly correlated with the challenges we have with overweight and obesity.
So looking ahead, are you hopeful that there can be some real changes made as these children are growing up and able to maybe find new ways to approach eating and exercise?
I think we've finally gotten our society, our nation, our state, our city, to understand the tremendous risk we're facing here. So I'm very optimistic. Bringing the science together with public policy, with healthy living promotion, we'll get there.
And one final thing, you know that dealing with parents and talking with them and their children about changing some of the eating habits, have you found that when kids have been more involved in the kitchen and cooking, that they're more likely to eat what they make?
I think that's a wonderful idea. I often talk with kids in the office about what they know about foods that are good for them, not good for them. We play a game about that. Get the kids involved. They love to participate.
All right, Dr. Perman, thank you so much for joining us. We certainly appreciate it. Some very good information.
Delighted to be here. Thank you so much, Jennifer.
You are welcome. And coming up next, Sarah Caldwell